Tongue ties are a congenital condition where the lingual frenulum, or the attachment of the tongue to the bottom of the mouth, is abnormally tethered, impairing the function or movement of the tongue. Tongue ties are classified in various degrees of severity. You've probably heard terms called anterior or posterior tongue tie. All they're really talking about is how far is your tongue attached? Is it attached all the way to the tip of the tongue or further back? Tongue ties can affect breastfeeding, particularly in nursing and newborn babies. That's probably the biggest reason that we see tongue ties here at UC Davis. There are other things that tongue ties can cause by affecting the mobility of the tongue, including concerns for bottle feeding or even speech as we get older. But the most common reason for needing to address the tongue tie is breastfeeding concerns. If you're concerned your baby has tongue tie, things you should look out for include increasing pain while breastfeeding, poor weight gain, or inability to extract a full feed while nursing. You can bring these concerns up with your pediatrician, and they can assess whether or not tongue tie is playing a role in that. We do an assessment of kind of what the anatomy looks like by me and what the function of the tongue looks like by our speech pathologist. If we deem that the tongue tie is affecting feeding, we can address it right then and there with a procedure called a lingual frenotomy. That procedure is just done in clinic in young babies. It takes about 1 to 2 minutes and is tolerated really well by the baby. After the procedure is completed, we have the mother feed with the help of our feeding therapist to assure improvement in breastfeeding pain or any other symptoms that are happening because of tongue tie. Babies have to suck, swallow, and breathe to breastfeed appropriately. So if any part of that is affected, then your baby's breastfeeding can also be affected. The tongue is only one part of that triad. So I also assess babies' breathing and their swallow function, make sure they're swallowing safely. We do also see older children with tongue tie, but the indications for clipping that tongue tie are very different than a breastfeeding baby. We want to make sure if it's related to speech or function of the tongue, we want a full evaluation by our speech and language pathologist to ensure that this procedure is indicated. You can see a pediatrician or a dentist or an otolaryngologist like me to treat your tongue tie. As someone who's a medical provider, all of my procedures are done through medical insurance, and the only out-of-pocket cost would be your copay. While if you were to go through other specialties, there might be more out-of-pocket costs depending on what kind of insurance coverage you have.